Governor John Carney, thank you for joining us once again for our periodic updates of the state of the COVID-19 pandemic here in the state of Delaware. It's good to be with you all again as we move into the fall season with summer behind us. We're here once again with Dr. Carol Rattay, who's the director of the Division of Public Health, and our thanks go out to her and her team for their great work. Dr. Susan Bunting, who's the Secretary of Education. Special thanks to Dr. Bunting, her team at DOE, and in particular all the educators, teachers, and school staff, bus drivers who work every day to make sure that our children who are back in school now with full in-person instruction get the education they need to be successful in life. We also have Pam once again, who's our signing expert for the deaf and hard of hearing. We appreciate her work as well. As we start this press conference today, there's one message that I want people to get away with. The bottom line is, the biggest takeaway is if we're gonna beat COVID-19, we've got to get more people vaccinated. It's really that simple. In our White House calls that we have on a weekly basis, and we had one today, every state across the country is facing that challenge. Getting those who are vaccine hesitant to take the step to work through whatever hesitation they have to make sure that they get vaccinated and get the protection that vaccines provide. And more importantly, as importantly, the protection it provides to the larger community in preventing larger scale spread. We have been over the last couple months, and we'll look at the data in a minute, experiencing a surge, late summer, fall surge of the Delta variant. Most of those positive cases are among the unvaccinated Delawareans and across the country. Some states and the states that have the highest vaccination rates have the lowest rates of spread, and those states that are experiencing real difficulty with respect to hospital capacity, our friends in Arkansas and across various states have among the lowest vaccination rates, say around 50% or less in some cases. And here in Delaware, we've been doing pretty good with vaccination rates. We met President Biden's goal of getting at least 70% of adult Delawareans vaccinated by July the 4th. And as you'll see in a minute, we've been making steady progress since then. We still have areas of our state, particularly the lower part of our state in western Kent County and Sussex County, where the vaccination rates are lower than what we need to get them to be, and particularly in the African-American communities in Kent and Sussex County. Our Latino vaccination rates are higher than the rates of the population at large, and so we've been able to make some real progress there. So let's just go look at the data in terms of the spread of the virus. These are data that we have been showing on a weekly basis throughout the last year and a half since we've been doing this press conferences. And you can see the new cases at a high level at 453. That's a 7-day moving average, so it's up and down. A lot of it's depending on the level of testing that's done. But by comparison, just at the end of June, we had 20 cases on a 7-day moving average. That was the low point. And so we've gone from 20 cases on 7-day average up to 453. You can do the math, it's a big jump. With respect to positive tests, we're up at 7.3%. 7.3% of the tests that are being administered are turning up positive. We were as low as 1% back in the last week in June, just for some context there, and have steadily gone up. Some of the assumption might be, well, we're doing fewer testing, and for a period of time we were, obviously, as there was less spread of the virus, but recently with requirements for employees to either be vaccinated or get tested, those testing rates have gone up, and folks have been required to get tested to travel and other for other purposes. Hospitalizations, you can see at 198 just a couple weeks ago in this late summer fall spread of the Delta variant, we were up as high as 275 hospitalizations. That compares to the high back in January of 476, but need to remember that Hospitals are more fully engaged with elective surgeries, more activity going on as people are doing more within the community. So the hospitals have encountered challenges. In fact, the hospitals in the lower part of our state in Kent and Sussex County have stopped elective surgeries and other provisions, which is not a good thing because they have more people in the hospital for COVID-19 than they can accommodate those surgeries. Sadly, we're almost at 2,000 lives lost, everyone a precious one, overwhelmingly those who are killed by the virus are people that are older Delawareans. So let's look at the vaccine update. Again, if there's one takeaway for today is if you're not vaccinated, get vaccinated. If you are hesitant for whatever reason, seek out advice to address whatever hesitancy you might have, because this is the solution to the COVID-19 pandemic. So we're, as I said, overwhelmingly Delawareans 65 and older at least have one dose, 97%, almost fully vaccinated. Those that are 18 and over, so adult Delawareans, were up to 78%. And then importantly, younger Delawareans that are eligible are teenagers 12 and up are 76% vaccinated. But if you look underneath those broad numbers, you'll see that some of the younger groups, young adults, are only at about 50% vaccinated. And so you're seeing a lot of positive cases in that young adult demographic. A couple of weeks ago, President Biden issued a requirement that private companies over 100 employees require that their employees get vaccinated, be vaccinated, or get tested. And obviously employers are meeting that obligation. Christiana Care, to their credit, took it a step forward and required all of their employees as a healthcare provider, as a hospital, as a venue that whose purpose it is to protect us and to cure disease, required all employees to get the COVID-19 vaccine. At the end, after that requirement went into effect, there were 150 employees out of 14,000 who decided not to get vaccinated. We did want to make clear through the Department of Labor that to the extent employers require vaccination as a condition of employment, like any other condition of employment, and they are then terminated because they don't meet that condition of employment, whether it's wearing a uniform or getting drug tested or getting a vaccine, they're not eligible for unemployment coverage, unemployment insurance for that, as they would not be for any other requirement of the job. So for some time, we've had the requirement that it's effective September 30th that state employees and staff in long-term care and other healthcare facilities be either vaccinated or get regular testing. Again, that the date that's effective for state employees is September 30th, and there will be a progressive discipline for those employees who choose not to get vaccinated. There are religious and health exemptions, which will be dealt with on a case-by-case basis. From the beginning, you've heard me say that our number one priority is to get our children back in school for in-person instruction. We have Dr. Bunting with us today to speak to this to a certain extent. And so we have effective by November 1st, a requirement that all education staff, all educators and school staff are required to show proof of vaccination or undergo regular testing, much like the requirement for state employees, again, by November the 1st. This is one way to keep everyone safe while the children and educators are in school for in-person instruction. And we have virtually every school district, every school in the state fully engage with in-person instruction. There are some virtual options that some districts are making available for their children and parents, but overwhelmingly our students are in classrooms, and we know that's the best place for them, for their educational needs and their social and emotional health needs. And so in order to keep everybody safe, we'll have the same requirement among educators and staff in schools that we do for state employees, and that President Biden has required of employers with 100 or more. We've heard a lot about the American Rescue Plan Act. We did have an announcement over a week ago that the first investment will be completing the last mile broadband and infrastructure in the lower part of our state, an investment of $110 million. If ever there was a time where we learned how important this broadband access was, the last year and a half has been that, with respect to COVID-19, the need to educate our children, keep people engaged for meetings at work, and just all other kinds of business and normal way of life. We do want to take this opportunity, since October is Thank a Nurse campaign through the Delaware Healthcare Association, to thank all the nurses, including our school nurses, who have just really gone above and beyond. I'm pretty sure they didn't sign up for a global pandemic when they decided to become a nurse, or took their job with their current employer, be it in a hospital, a healthcare, long-term care facility, or in one of our school districts, but they have been doing just an outstanding job. I've had the opportunity to thank them personally in vaccination clinics that we had as part of our school district program, and to thank nurses in our hospital settings. And I must say that our hospitals have really come up big as well. Christiana Care up north, Bay Health, BB and Title Health across our state, Nemours, and of course the VA hospital in St. Francis, just doing enormously important work during a very difficult time, and the nurses really are on the front line. Lastly, just to end where I started off, if we're going to beat COVID-19 and get back to a more normal way of life, and we are moving in that direction for sure, so many more things are open fully than they used to be. Hopefully, folks are wearing masks indoors as the CDC is recommending, to make sure that we prevent the spread with those kinds of contacts in the public. But make sure you get your COVID-19 vaccine. If you need information about it, you can get that at de.gov/getmyvaccine. If you have hesitancy, you can reach out to your primary care physician, to other healthcare provider, to get those questions answered. And let's lead the way here in Delaware in getting folks vaccinated. You know, we've got a very high number, well, almost 100% of people in my demographic, 65 and older, who are vaccinated. When we talk about 18 and older, again, we're closing in on 80%, and even the younger group and older, but it's not consistent throughout. Again, our young adults are the least likely to be vaccinated, and therefore very vulnerable to the spread of the virus, to spreading it to others, particularly those that are most vulnerable. So the way to address that is to get vaccinated. If you've been vaccinated, you're the older group. Dr. Rattay is going to talk about boosters and third doses. And with that, I'll turn it over to her for her presentation. She's also going to be a little bit more regionally specific about where we're seeing the most spread and where we really need. We're seeing the most spread where we have the lowest vaccination rates. It's really that simple. It's the same as states across the country, as we hear each week on the White House call. Dr. Rattay, thanks for your great work and for your presentation today.
Thank you, Governor. And that's exactly right. We are definitely seeing higher levels of cases where we have lower vaccination rates, like in the rest of the country. But overall, as far as our COVID situation right now in Delaware, as you mentioned, we do appear to be seeing a leveling off of cases, which is a good thing. Last week, our case rate increased less than 1% from the previous week, which is great because when we last had our press briefing in August, the cases had increased almost 80% the previous week. Percent positivity, hospitalization, and death rates have also decreased statewide. And additionally, testing rates have increased 2.2% since last week, and we do expect that trend to continue. For the first time, we are seeing that the 5 to 17 age range has the highest case rate statewide, as well as in Kent and Newcastle County. We are doing a lot more testing in our schools, which is great with the Kydell partnership. So we're finding more cases in our schools earlier, which is very helpful for the spread. In the past, though, I will say that typically almost every week for the past year, it's been our 18 to 34-year-olds who've had the highest case rates. And this age group still has higher case rates, running a close second place to our 5 to 17-year-old school-age kids. So on the next slide, let's talk a little bit about areas of concern. And it's been a while since we've talked about this. Using the criteria that I have used during much of the pandemic, you would see much of the state in that blue color right now. So we are really seeing statewide higher levels of infection, using a little bit of a higher bar by looking at zip codes that have a case rate of 450 per 100,000 or higher, and a percent positivity of 25 or higher. You can see what I'm referring to as kind of our hottest spots right now, which includes large areas of Sussex and Western and Southern Kent counties, as well as the city of Wilmington. And as the governor was mentioning, if you look at that map on the right side, you're seeing that our highest rates do correlate with the areas where we have the lowest vaccination in our state. Let's move on to the next slide, which shows that among our cases since August 2nd, that an overwhelming majority of our cases are not vaccinated or not fully vaccinated. And I will say that the not fully vaccinated numbers make up a very small percentage of that total. So of the more than 17,000 cases, 79% were unvaccinated or only partially vaccinated. And of these cases, we know of 815 that were hospitalized, and 82% of those were unvaccinated. We had 59 deaths during that period, and 64% of these were unvaccinated. So it's important to know that the vaccinations work great, but it's also important to understand statistically that breakthrough cases are likely to occur. It happens with any vaccine. And I recently heard a good comparison that I think helps people understand. If you think of the vaccines like an umbrella and it's raining outside, before Delta came around, the rain was maybe a drizzle. Most people who had an umbrella were not getting wet at all and could go outside and do pretty much what they wanted without concern of getting wet. Very rarely a person with an umbrella might get a few drops on them, but overall they were staying very dry. The Delta variant is more like a downpour, and umbrellas are definitely still helping, and it's way better to have one than be stuck in the downpour without one. But because it's raining harder, some people with umbrellas are still getting wet. Now they're still far less wet than those without umbrellas, but some are more wet than they were before because when the rain was just a drizzle. So again, that's how the numbers work with these breakthrough cases, but the data are clearly showing that vaccination has severely cut down on the number of people dying in our state, seriously cut down on the number of hospitalizations and cases of COVID. Again, most all of those are among individuals who are unvaccinated. And in fact, recent CDC data even shows that hospitalization rates are 10 to 22 times higher among the unvaccinated individuals compared to vaccinated adults. I just want to touch base quickly on the Delta variants, which continues to be the predominant variant strain in Delaware. It's on the next slide. Currently, it accounts for about 99% of the variant positive test samples. I think we don't have that slide anymore, but the point of the slide is that 99% of our variant samples now are testing positive for Delta. So it's clearly the predominant strain in our state. Let's switch gears now and talk about vaccine boosters and third doses. So much has been in the news lately about third doses and booster doses, and I wanted to spend a moment clarifying the difference between the two because this is confusing. And then I want to get into more detail about the news from last week's announcement from FDA and CDC on boosters. So first, let's talk about third doses, which are also being referred to as additional doses. They were authorized August 13th by the FDA for emergency use for people who have moderate or severe compromised immune systems, meaning those are people who may not have been able to develop the same immune response as other individuals. And so this might include recipients of organ or stem cell transplants, those in treatment for HIV or cancer, those taking immunosuppressive therapies like a chemotherapy or high-dose steroids. We also, based on our Delaware data, as well as national and international data, are asking providers to use their clinical judgment to determine whether age and long-term care residency should make individuals eligible. And that would be especially those who are over age 85, whose immune response may not have held as long as others. So for third doses or additional doses, if you have received Pfizer or Moderna at least 28 days previously, individuals can get a third dose. And I will say for third doses as well as boosters, they're not authorized for Johnson & Johnson recipients yet, although that is being studied. So that's third doses, again, for people who are immunocompromised. Last week, the FDA voted to authorize booster doses of the Pfizer vaccine, so only the Pfizer vaccine, and only to persons who had completed their initial series of Pfizer vaccine at least 6 months ago. So data from a clinical trial show that the booster dose of Pfizer vaccine produced a 10-fold increased immune response against infection and severe COVID and restored high levels of protection, especially among older adults. Among adults 65 and older, the data show that vaccines remain effective in preventing hospitalization and severe disease, but the recent evidence suggests that they are less effective in preventing infection due to waning over the time. And the Delta variant has made this even more complicated. And so these are the reasons why the boosters are especially important for our seniors. Boosters are not yet authorized for Moderna, unlike with third doses, and again, not authorized for individuals who've had Johnson & Johnson. So let's talk about the booster recommendations. The CDC Advisory Committee convened last week to make recommendations on who is eligible for a booster dose of Pfizer. So CDC placed their recommendations into two categories: those who should receive a booster dose and those who may receive one, though it is less critical if you're in that may category. Those who should receive a booster dose of Pfizer as soon as possible include anyone who's 65 or older, anyone who is a resident in a long-term care facility, and anyone between the ages of 50 to 64 with certain underlying health conditions, those ones we've been talking about all along that put you at higher risk of COVID. So cancer, heart disease, lung and kidney diseases, dementia, diabetes, Down syndrome, HIV, overweight and obesity, pregnancy, organ transplants, and stroke. If you're in that category between the ages of 50 to 64, please get your booster shot now, or if you're over the age of 65. Now, other individuals are eligible now to get their booster shot. So that could be anybody who's 18 to 49 who meets those chronic underlying health conditions, or individuals between the ages of 18 to 64 who are at increased risk due to occupational exposure. And this includes a lot of folks: first responders, healthcare workers, teachers and daycare staff, grocery workers, manufacturing workers, U.S. Postal Service workers, public transit workers, those working with congregate settings, including long-term care facilities, homeless shelters, or correctional facilities, among others. And it's important to note that while we are thankful that boosters are available, DPH remains focused on getting more of the state's eligible population fully vaccinated to begin with. But those who are eligible for a booster can get one from pharmacies, participating primary care providers, any of our DPH standing vaccine clinics. And as always, you can find a list of places offering vaccine, as the governor mentioned, at de.gov/getmyvaccine. Before I close and turn it back over to the governor, I just want to touch base on what we're seeing in the data for COVID in children. This is a topic that a lot of people are very interested in right now, especially because of what has been seen with the Delta variants in the southern states. And so if you look at the graph on the left, you can see that our cases among children, school-age children 5 to 17, has continued to increase. Now, in early August, we saw our greatest increases. So the increase has slowed down since the middle of August. So that's good. But you can see that we have seen a rise in the last 6 weeks or so among our school-age kids, as well as among those youngest kids between birth to 4 years of age. We've also seen some increase in pediatric hospitalizations. That's not as high as it was last winter, but we have in September had already 42 pediatric hospitalizations. So not as dramatic as some of what our southern states have seen, but we have seen more cases among children recently. And as the governor said, his priority is to keep children in school and learning. And part of that is to encourage those children who are vaccine eligible to get vaccinated, and for the adults around them, whether at home or school, to get vaccinating. And that's part of the reasoning behind the governor's requirement for teachers and staff to either be vaccinated or undergo weekly COVID testing, especially when so many kids still are not eligible for vaccination. We can protect them if the adults and others around them are. In pediatrics, we call this cocooning, and it's an important strategy to protect those who cannot be vaccinated. So with that, I'm going to hand it back to you, Governor.
Thank you very much, Dr. Rattay. And so the information there is that if you are immunocompromised, you can qualify for a third shot, and then there are qualifications, obviously, for a booster shot as well for those who are elderly, those 65 and older, and those just below that with special risk at work and with a health condition, immunocompromised as well. So know those distinctions, whether you're eligible, and avail yourself to that extra protection. Again, the bottom line is, the main message is here: we need to get folks vaccinated. Those who aren't vaccinated, let's address the hesitancy you have. The higher our vaccination rates, the lower our infection rate is going to be, and we're seeing that again across the country. It's not just one area or another, and we're seeing it here in Delaware, the lower part of our state. Western Kent and Sussex counties with the lower vaccination rates have the higher infection rates. So one of the most important things, or the most important thing, is to keep our children back in school for in-person instruction, and to do that in a way that's safe for educators, staff, and for the children many of whom are not eligible to be vaccinated. And so that's the reason, as Dr. Rattay explained, for protecting all in this enterprise, and the requirement that educators be vaccinated or be tested. Dr. Bunting's here with us today to talk about that and the education enterprise here in our state.
Thank you, Governor. And as you've heard, we did make an announcement today that we are going to require our K-12 staff members to either be vaccinated or to weekly go to some setting and have the testing done and report out on that, all in a way to create a safe environment for learning and to prevent disruptions to learning as our children experienced last year. We're thrilled to have all of our schools back open and offering 5 days of instruction each week. It's a delight for us, and we have been very interested in making that a secure and safe environment. If you'll remember last year, we had an initiative to have our teachers vaccinated, and through our efforts had clinics in our schools and vaccinated over 16,000 of our school employees. So we're building upon that, and we're also mirroring the state requirement for agencies. And this is something that we're giving several weeks for educators who haven't been vaccinated to have that opportunity. So it will come into play by the 1st of November. There are also arrangements being made in schools. We have 19 charters and 11 districts who have partnered with Quidel to actually have testing done at school sites on a regular basis. And so we're making that effort to make this as easy a requirement as we possibly can. If we go to the process on the next slide, schools and districts are going to have different procedures to follow up on this, but their procedures, their process must include a secure mechanism for handling the vaccination information, being able to determine who has been vaccinated and who is in the process of weekly being tested. They also need to have a mechanism to ensure that regular testing is available on site if possible, as I mentioned, with the partnership opportunities with Quidel. There are also many community opportunities to get testing from local drugstores to some of the testing sites that we've had before, and watch for those opportunities. They are numerous. We also expect that there will be a discipline policy that's going to be developed locally. They already have a policy in place, a progressive discipline policy for handling whatever the infraction might be. And so this is another way that people who are going to be vaccinated or not will be following established procedure done by the local education agency. On the next slide, there are a number of resources that are available to all of us. The guidance that has been put out by the Division of Public Health. We do have DPH liaisons working with our schools on a daily basis. You also can find a lot out about the testing that's available through Quidel, or as I mentioned, many of the community testing locations that is regularly publicized. And policies will be posted. You also can look at the policy that is in place for state employees to guide their own processes. So as we look at our final slide for school update, all charters and regular school districts are offering, as I mentioned, in-person instruction. There are a few districts who also have a virtual option. There's a virtual academy, for example, in one of our districts, and then a smaller scale offering in others. But everyone now can have the guided 5 days a week instruction, and that is something we're extremely excited about and want to preserve that opportunity for our students. Our students are back. We are at this point trying to establish baselines to see exactly what the proficiency level of our students happens to be and what their needs are, and particularly in math and language arts, what their reading levels might be and what kind of supports we might need to be offering. We are enthusiastic about the teaching and learning that is happening when I visit classrooms. I also see the impact of summer efforts. We had over 12,000 students actually in classrooms during the summer, but we had a huge state initiative that accelerated learning in preparation for the very foundational, the basic things that our students had to have to be able to move into grade level instruction this school year. And we will continue to monitor where our students happen to be performing. We will then provide the extra supports. We're very blessed to have stimulus monies that enable us to put in extra support personnel to help fill in some of those lost learning opportunities and make sure that our students are getting additional supports of whatever nature they need to help their learning be successful this school year. This may take more than this particular school year to make sure they're back to where they once might have been, but we have the personnel to do that. We have the mechanisms in place. We will be offering after school opportunities, extended day opportunities, and naturally we will have a robust summer program system for next summer. So with all of that, we're very hopeful that our students are going to be, in some people's terms, catching up. We prefer accelerating the learning concept, but we are working hard to make sure that our students will have a very beneficial learning year this year. Governor, I turn it back to you.
Thank you, Dr. Bunting. An important point to make right here now is that the school districts across our state are receiving millions of dollars in American Rescue Plan Act funding from the federal government, as Dr. Bunting mentioned, to address the educational needs of their students. And importantly, these funds are coming at a time when students haven't been in school for in-person instruction for a large period of time last year, and obviously now we've got most, if not all, of our students for in-person instruction now, and so now's the time to use those resources to make sure, first do the assessments, as Dr. Bunting mentioned, to benchmark where the children are in their learning, and then to help accelerate them forward. And this is going to be a process not just for this year, but I'm sure into next summer as well and beyond. So those resources are incredibly important for that, to achieve those objectives. And we thank our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt-Rochester for that assistance. Lastly, again, just another commercial for the COVID-19 vaccine. Make sure that you get it. The solution to all this, all these problems, the sickness, the death, the restrictions, the mask wearing, all of it comes back to folks getting vaccinated, protecting themselves, protecting our senior citizens, protecting our children, and importantly, now protecting our very scarce hospital resources. Even though we're half of the number of hospitalizations that we had at the peak last winter, the hospitals are serving other patients, doing elective surgeries in the northern part of our state. They've had to close down those elective surgeries downstate because of the surge in COVID cases. And so everybody, those who are not vaccinated, could help us solve that problem, take some of the pressure and stress, as we thank our nurses working in hospital settings and long-term care settings by getting vaccinated, by addressing any hesitancy that you might have to do that. Obviously now we're saying that it'll be a requirement for educators to get vaccinated or get tested, and an extra layer of protection for themselves and for the children that they are working with and teaching, and for that whole enterprise. So with that, I know we have a number of representatives from the media who have joined us, and we look forward to their questions, some of which I believe have been pre-submitted.
Great, thanks, Governor. Our first question comes from Amy Cherry of WDEL. Amy, you have the floor.
Thanks so much. It was mentioned today that a progressive discipline policy is or will be in place for state employees and school employees who either don't get vaccinated or refuse to get tested. Can you talk more about what that looks like?
Yeah, so I don't know the details of it. I just know that it doesn't result in somebody losing or getting fired right away. There are various levels of discipline. In some cases, you get docked a day or docked some time or period of time, and then moving up, allowing the employee to correct that situation. It does vary, I think, among school districts and state employees, and so there is some difference there.
One other question that I had was, who is defined as a contractor under this policy, and whether that includes school bus drivers? And if so, are you afraid this will lead to even more difficulty hiring for these jobs that districts had trouble with?
Yeah, so I'll let Dr. Bunting talk about contractors, but there's always the concern when you have a requirement like this, and we had it with respect to state employees, with respect to nursing home employees. And I know The hospitals had similar concern, and that has to be balanced with the benefit of having those employees vaccinated, as opposed to putting people at risk of giving folks the virus. Dr. Bunting, anything to add in terms of who qualifies as a contractor?
Amy, in various districts or for the charters, there are different arrangements for how the transportation is done. In some cases, the people who drive the buses are actual district employees, and they naturally would be covered under this policy. In other cases, you contract with a company to provide the transportation, and sometimes those contractors are actually people who drive buses, but in other cases, the contractors hire bus drivers. So it would depend on whether or not your contractor himself or herself is driving the bus as to whether he or she would come under this policy. But the bus driver, the person that's on the bus with 25, 30, 40 students is the person who needs to be protected so that he or she can protect our students. So it depends on the role of the contractor, but in many cases, contractors don't actually drive the buses. So the districts will be attuned to what the role of that contractor happens to be, and the policy then would be put into place.
Thank you. Our next question comes from Tim Mastro from the Delaware State News.
Hi, everyone. I know the Quidel testing program, I know not every school district is using that yet. Some school boards are still voting on it. Do you think with testing now becoming mandatory for unvaccinated employees, do you think that this program might become mandatory for each school district to use it? And will you consider making students test weekly as well?
So we tend to allow districts to make those decisions. So Dr. Bunting, any thoughts about that?
I think you're correct in that districts will be making those decisions, and it would be something that is going to be decided by the local boards of education or the executive board of a charter school.
All right, and just curious if you have any statistics as of now of how many of educators and school staff are still unvaccinated at this point.
There was a survey that was done some time ago. I'm sure it's out of date. Dr. Bunting, any thoughts about that?
Districts may have that information, but we do not have that here at the department.
Our next few questions will come from the News Journal. Carl, we'll start with you and then move on to Brandon.
You might be on mute. I can't hear him.
Can you hear me now?
Yes.
Apologies. Sorry about that. One very quick clarification. I still write for the News Journal, but I'm now technically independent. Anyway, this question is about the Port of Wilmington. You may have seen the story that the News Journal ran a couple days ago. I have not been able to get an answer to an underlying question of, and for you, I'll just say, is it your understanding that Gulf Tanner paid its June 30th concession fee payment to the Diamond State Port Corporation? And if they did, when?
I don't know the answer to that. I do know that they've been paying and living by the contract. There have been, obviously, with the unprecedented economic situation over the last year and a half, there have been challenges that every business has had, particularly those involved in international trade. But my understanding, I know they've been making investments in the facility as required. I know they've been making payments, and I think I did see the article. I think the question is, compared to what? The Port of Wilmington, as long as I can remember, and I was involved when I was Secretary of Finance in the initial purchase of the port from the city of Wilmington, and that was done fundamentally to relieve the city of that financial burden because it was, being a drag on the revenues of the city. That's always been the case. It's partially because of the intense competition on the river among the ports. And I know you've talked to a lot of people. A lot of those people want the Port of Wilmington to fail. We want the Port of Wilmington to be successful, which is why we entered into this agreement with Gulf Tainer. Obviously, it's been a difficult year and a half, but we were encouraged that those commitments will be met in the months and years ahead. And fundamentally, it's about the jobs that are provided by port employment and that commerce. We're looking forward to permitting an expansion of the port to Edgemore and having Gulf Tainer make those investments that would enable the creation of additional jobs. But I mean, I think the question always has to be compared to what?
Mm-hmm. If they missed their June payment, would it be your expectation that you would hear about that?
If they missed their June payment, whether I as governor would hear about it, I hear periodically from the Secretary of State who's on the board there and from the board, but I'm aware of some of the challenges that they've had, obviously, with the reduction in international commerce and trade, but specifically no.
Okay. Is there a way your people can get that answer to me, whether they paid in June or not?
I can certainly ask them to.
Okay. Thank you.
You're welcome.
All right, our next question is from Brandon Holvick.
Good afternoon. In August, you announced the mask mandate for schools and later the rules for being vaccinated or tested for state employees. I'm curious, what put this decision till now, why you didn't mandate vaccination or testing for school employees around that time or sooner than now?
Yeah, I would say it was an issue that was something that we were looking at, something that we felt like we had to work to cultivate the ground among educators to see what the districts themselves were willing to do. You may, as you say, we did have to make the mask a requirement, and became an issue of some significant controversy within the school boards across the state. But this was particularly after President Biden made the step forward to require employers to require vaccination or testing. We had done it ourselves for state employees. Christiana Care had gone a step further and required all their employees to get vaccinated. We just felt it was the right thing to do.
And you mentioned there and before about Christiana Care and how they mandated vaccination without the testing option, sort of giving them kudos. Did you think about, for either school employees or for the state employees, not including the testing option, and what ultimately kind of led you to giving the choice of vaccination or testing?
Yeah, I mean, we tried to figure out what was the best way to get people to get vaccinated. And so that's how we landed on, that's the objective, right? The objective, as I've said to our team all along, the objective is to get as many people vaccinated as possible. What's the best way to do that? What's the best way to meet people where they are? Just tell them, the governments tell them they have to get vaccinated, or giving them an option, make it uncomfortable or costly to do it, to not get vaccinated. And you can see how private organizations, the NFL comes to mind. You've heard me say that before, with respect to getting folks, beyond hesitation, beyond, unreasonableness there, because we know it's to the benefit of everyone that folks get vaccinated. It's not just a decision that affects you individually. It's a decision that affects everybody that you come in contact with. So yeah, that was part of the calculus, and we'll see how it goes.
Next, we're going to move to our pre-submitted questions. The first one comes from Melissa Steele of the Cape Gazette. Melissa asks, pregnancy concerns seem to be the leading vaccine hesitancy among 20 to 30-year-olds. They want scientific studies and reports with details. Is Delaware trying to track the number of young women who have become pregnant after receiving the shot?
Dr. Rattay?
Sure, it's a great question. And really, when it comes to vaccine studies to study safety and efficacy, the federal government are the experts in doing that. Also, being a small state that we are, it might be difficult to have the numbers we would need to do those studies. So we really look to FDA and CDC to do those studies. And the good news is, since the beginning of these vaccines, the vaccine administrations, a lot of data have come into the databases, and pregnancy and fertility, both areas of concern for women of reproductive age with the vaccine, both of these issues have been very well studied. So now we've got really strong evidence that shows not only is taking any one of these three vaccines during pregnancy safe with very limited side effects, just like if you were not pregnant, but it also is very protective and really critical for pregnant women to prevent adverse events to pregnancy. The studies are showing that the antibody response travels from the mom to the baby, so it helps to protect the baby when the baby is born, which is also great. And the other area of concern that we hear a lot is that some people are worried that the vaccines could impact fertility. And this is another reason why this is really well studied, and there's no evidence whatsoever, nor is it feasible for these vaccines to impact fertility for women and even men of reproductive age. So the studies are good. This is the most well-studied vaccines that we've ever seen in our lifetimes. And we're really pleased with the results on this front.
The next question comes from Radaris Richardson at WRDE and Telemundo Delmarva. Tackling vaccine misinformation and reaching minority communities has been difficult since the start of the pandemic. What efforts are being done by the state this time around to ensure minorities trust getting booster shots and that booster shots are also available to the growing Hispanic community? The second part of the question, are materials being translated in other languages?
Well, the answer to the second part is absolutely, and Dr. Rattay can talk about that. And I think Telemundo is a good example of a partner that's helpful in getting the word out. The fact of the matter is the vaccination rates in the Hispanic community are higher than the Hispanic or vaccination rates in the total population, the white community, African-American community. Where we lag is among young adults of all ethnicities and races, and particularly the African-American communities in the lower part of our state. But the Hispanic community has done an amazing job of getting shots in arms, and clearly we will have boosters ready for every community and use those systems that worked to get their initial shots in arms among the Hispanic community. Telemundo is a great way of getting that information out. I think it goes without saying everything that we put out is in Spanish and Haitian Creole. Dr. Rattay, anything to add to that?
No, I think you summarized it well. I mean, we have some, I think the response from our Hispanic Latinx population is a tremendous success story in this pandemic. This is a community that's really come together and has resulted in high vaccination rates. we've worked to help support champions and get materials out there in Spanish, and as the governor said, Haitian Creole as well. But I think really what's been so heartening and helpful is really a lot of the grassroots efforts among the Hispanic community in our state to protect this population.
And if you look at some of the sub-demographics, the teenagers, higher. Young adults, higher. Older adults, higher. Senior citizens, higher. At every age demographic, Hispanic numbers are higher than the white community numbers.
Okay, our next question comes from Annie McCormick of 6ABC. Annie asks, Christiana Care has lost 150 employees due to the vaccine mandate. The 150 employees did not want to get vaccinated. Is there a level of concern that healthcare workers don't want to get vaccinated?
I think those numbers are pretty good, given the fact that they have 14,000 employees and the fact that now they know that everybody who's going into their building every day is protected with vaccination protection. If you think about the important role of hospitals, I mean, that's where, they talk all the time about infections that you pick up in when you're hospitals. They can't afford to have employees that are bringing in the virus from outside of their doors, and they made that decision, I think, to their credit. And I think the effect has been minimal when you consider the overall number of employees. Obviously, in every situation, the concern is you're going to lose folks. Nobody wants to lose anybody for any reason at all, not least of which is in terms of getting an important thing like a vaccination here. But it's something that you have to consider the trade-off. Is the trade-off the better, safer environment, work environment for everybody else? It's not just about an individual. It's about everybody around that individual, because those are the people that are being put at risk. Dr. Rattay, any other thoughts on that?
Nothing to add other than I will absolutely echo. I think the Christiana Care story is a real success story, and 150 individuals, and from their information, many of them were not clinical staff. So I think most clinical staff recognize this is really key for us getting out of the pandemic.
Our last question comes from Zach at WBOC. Zach asks, who is funding the mandatory weekly testing for teachers, faculty, et cetera? Are those funds coming from the state, the school districts, or teachers themselves? Additionally, is that answer the same for private and charter schools?
So there are a whole vast array of places across our state where people can get vaccinated or tested for free. Just go to the website, de.gov/getmyvaccine, de.gov/coronavirus, and you get information about testing. You can get information about access to free vaccinations as well. So any other questions there?
Nope, that was our last pre-submitted question.
So let me thank those who tuned in again. Let me conclude with where I started. First, by thanking Dr. Rattay and Dr. Bunting for the work they do every day in public health and in our schools and education, and making sure that those very important functions of state government get done and accomplished, put Delaware at the top of the heap, if you will. And I think we're doing well. We still have a lot of work to do, both in terms of getting more people vaccinated. We're in the top half for sure of states. I'd like to be in the top 10. We may be in the top 10. I certainly want to be in the top 10 with respect to the quality of education and the quality of our schools across Delaware. And we know the way to do that, the way to keep our children safe, the way to keep communities safe is for folks to get vaccinated. Over 95% of senior citizens 65 and older in Delaware have seen the wisdom in getting vaccinated. But as little as 15%, or I'm sorry, 50% of Delawareans who are in the young adult category have been vaccinated. We're over 50%. For the longest time, we were dragging there, and then areas of Kent County and Western Sussex County, the rates are around 50% as well. So we need to address the hesitancy of those populations. We have requirements now that folks get vaccinated or get tested. That it does add an extra layer of protection. The goal for all of us is to have a strong economy and a healthy community. And for the last almost 2 years now, we've been pushing towards that objective. So thank you all for joining us, and we look forward to seeing you next time. And we look forward to those of you who are not vaccinated to take that shot.